diaphragm muscle there. When the diaphragm contracts, it moves inferiorly like this, okay? So it contracts and it moves like this. All right, so we just changed from a space that's this big, right, to a space that's now this big, right? So we've increased the amount of the volume of this space by this much. We've increased the volume when that diaphragm contracts. So if the volume increases, the pressure decreases. Air is going to move from outside to inside, right? When the diaphragm relaxes, then it's just going to move superiorly again. So let's take a look at, here's the diaphragm in the normal position. In this position, the pressure inside the pleural cavities is going to be the same as what it is outside. And the diaphragm is relaxed, okay? These diagrams. I had it and then I tried to save it, but it didn't save it. Okay. All right, so you're just going to have to envision this because I don't know what happened. The publisher changes these all the time, and I took the old ones that I had and I tried to save it and it wouldn't save. So anyway, this is the diaphragm at rest. When you when the muscle contracts, when the diaphragm contracts, it's going to flatten out, right? And when it flattens out, it's increasing the volume inside this area by this much. So when we're increasing the volume, that decreases the pressure. Air is going to move from outside to inside. Now, it's not going to be a ton, right? It's not going to be a ton of change, but we know that the atmospheric pressure is about 760 millimeters of mercury, okay, 760. The inside, during inhalation, it will only change about 1 millimeter of mercury, but it's enough. It's enough to bring the air in. So the diaphragm contracts, you're increasing the space, that's decreasing the pressure by 1 millimeter of mercury, and air is coming in, okay? During exhalation then, the diaphragm is going to relax and come back up, and now you've increased that pressure, and because there's so many more air molecules in there, you've increased the pressure even more. Now the pressure inside the thoracic cavity goes up to 761 millimeters of mercury. So now that you're going to blow it out, because the atmospheric pressure never changes. At sea level, it's 760 millimeters of mercury, right? So you're bringing air in and breathing it out. Now, when you're heavy, when you're breathing really heavy, during exhalation, that pressure can be, inhalation, I should say, during inhalation, that pressure, that -1 millimeters of mercury, if you're breathing really heavily, it can actually drop to -30 millimeters of mercury. So that's a big change in the difference between out here and in here. So it's 760 out here, 730 inside your lungs. Okay, so a big difference. And then, you can't see this, but when straining with the glottis closed, when you're straining with the glottis closed, the pressure inside your chest can actually go up 100 millimeters of mercury, right? That's a big change. So, you know, when you're doing what's called a Valsalva maneuver, when you're exhaling against a closed glottis, that's your straining, you know, and trying to push out, and this is something that they do a lot of times with a spirometer. They'll ask you to do that because they want to see what the pressure is. That will cause that it'll compress the aorta and the vena cava when you're doing that, when you're straining against a closed glottis. And that will also cause some reflexive changes in the blood pressure and your cardiac output. Okay? It's kind of like you're squeezing on that, that vagus nerve, and it's going to stimulate a parasympathetic response. You're going to get a decreased cardiac output, and you're going to get a decrease in your blood pressure. Okay? All right. Okay, so let's go back and look at a couple of other terms here. Compliance. Compliance is the ability of the lung to stretch and expand. Okay, so a normal compliance, your lung, every time you're breathing in, the lungs are expanding. Every time you're breathing out, then they're contracting again. The lower your compliance, the greater the force is required to expand and fill the lungs. So if you have a disorder like cystic fibrosis, if there's a person with a cystic fibrosis, that means they have decreased compliance. You know, they've got a lot of fibrotic material, fibrotic tissue in their lungs. They can't expand, they can't contract. It's just kind of stiff, right? Also, pulmonary edema. Pulmonary edema means there's a lot of fluid surrounding the lungs, so it's like pushing on the lungs. So of course the lungs aren't going to be able to expand or contract. So they're going to have a decreased compliance because they're not going to be able to do that, expand and contract. A person that has a thing like emphysema, emphysema is where the airflow is obstructed, you know, and what ends up happening is that their lungs will hyperinflate because they're trying to, or COPD, some of the other, anything with an obstructive disease, the lungs are trying to hyperinflate because they can't get the air out, right? They're not able to get the air out, so they've got an obstruction and they can't get that air out, so the air is building up inside their lungs and the lungs are stretching out, so they actually end up with an increased compliance. And because it's stretching so much, they lose that elastic recoil, and now the lungs can't go back to their normal size. So disorders like that, obstructive disorders like that, is going to mean that they have an increased compliance. Okay, do you guys understand why that's increased? Okay, can't get the air out, stays inside. Okay, there's some other things that affect compliance, like the level of surfactant. So what surfactant does is it reduces the surface tension, okay? So that the alveoli can expand more easily. The alveoli, okay, they need to be able to expand And if there isn't enough surfactant, then there's going to be a lot of surface tension, and that alveoli is going to collapse. Right? Also, the mobility, so that would actually, alveoli would decrease the level of, decrease compliance. Okay? It reduces surface tension. Okay, also another thing that can happen in the thoracic cage is that you can have arthritis or skeletal disorders, and that would decrease compliance as well. The lungs aren't going to be able to expand and contract. They're not going to be able to fill up as much with air if there's like arthritis in the thoracic cage, in the spine. Those things are going to be limiting. Your thoracic cage also has to, there's muscles that have to contract to lift the thoracic cage, as well as the diaphragm, which is going to pull down to increase the volume in there. So that would decrease the compliance as well. Okay, so let's look at the intrapleural pressure. Intrapleural pressure. So the intrapleural pressure, the name tells you that we're talking about in between the pleural membranes, right? You guys remember the pleural membranes? The intrapleural pressure is going to be about a -4 millimeters of